when I was working like in a small group private practice, seeing patients every 15 minutes, like insurance brace, I will never forget that sinking feeling in my chest that I had where this little voice would tell me I could have done more for them.
Mm.
But then I would have to just move on to the next person. And those, you feel it in your body. Like my body remembers that. It's never going to forget that. And I realize not only do I deserve better, but I think human beings deserve better. Our patients deserve better.
And hugs are really good. I love hugs.
I love hugs. And it's like the best medicine. Like it's like cheap. It's like, yeah.
Yeah, nothing better than a good hug. Like don't
Yes.
half-ass the hug with me. Welcome back to today's episode of the Morning Waltz podcast. I'm your host, Alisa Walters. They say that laughter and food is the best medicine. My guest today proves just how true this is. I'm sitting down with the brilliant and hilarious Dr. Priyanka Wali, a board-certified internal medicine physician and a stand-up comedian. Wali uses humor to make medical topics more accessible and engaging, to foster a deeper connection with her audience and her patients. Dr. Wali, thank you so much for joining me today.
Oh my gosh, with an intro like that, I mean, how can I top that? It's only downhill from here now. Oh my God. Thank you. Thank you. I'm thrilled to be here.
All right, I'll see you later. No.
Yes. Oh.
Where are you currently based?
So I am currently in Southern California. I am house sitting for my dear parents at the moment. So pardon any crappy level internet situation we have going on here. If we get cut out or if I suddenly go dark on you, it's not my fault. I take no responsibility for it.
Well, you are very clear. So if anything
Oh,
happens,
thank
we'll know why.
goodness.
So Dr. Wali, I want to start by you have these two very different careers as a physician and also as a stand-up comedian. And I want to take me back to the beginning. What came first? Have you always did you always know you wanted to be a doctor? Did you always have this comedic side that you wanted to share with the world? Let's go back to the beginning.
Yeah, well, we can go way back to the beginning, I suppose. I mean, if you really want to go back, like even ancestrally, my family, I come from a long line of physicians and healers in my family. In fact, going back, my great grandfather was one of the first anesthesiologists in northern India in Kashmir, where my family comes from. And so, I've talked about how like it was sort of like no question that I was going to go into the healing path. That I joke like I came out of the womb holding a stethoscope, and I was like diagnosing ear infections on the playgrounds by the time I was 3 years old. And essentially, I have always been a bit of a clown. I've always been an artist. Like humor has always been in my bones, and playing has always been part of my spirit. And so it seemed only natural that eventually, as time would pass, I went to medical school, I was in residency, I was working 80 hours a week, and I felt like my soul was really missing something. Like there was something that I needed beyond just the hard nitty gritty day-to-day practice of medicine. And that's when I decided, let me try my hand at stand-up comedy. It was a solo art form. It was something you could do after hours. So it seemed to fit my schedule. And it was also sort of this like unknown for me. And so I remember as a resident, I was in the Bay Area in San Francisco, and I literally Googled like good place to do stand-up comedy for the first time in San Francisco. And the first website that came up was a laundromat slash cafe slash open mic. And literally, I remember reading on the website, it said, "This is Brainwash Cafe. you can do your laundry, and this is a really good place to do stand-up comedy for the first time in San Francisco. And I was like, okay, well, that seems pretty appropriate, and I could get some clothes washed while I'm there. And so I went there, did my first open mic, and actually it went really well. There was a local producer in the audience who I guess was doing his laundry too. And I got booked for my first showcase just then and there. And things just really took off. And I ended up performing so much that by the time I graduated residency, I realized like I'm going to have to split my time and really work part time in medicine and pursue this performing arts. And I really am grateful because in so many ways, stand up really kept me sane. During those very grueling years of residency, and eventually it evolved into acting, storytelling, and then eventually studying clowning, which I think was much harder than anything I had ever done in medical school. Like if clowning is probably one of the hardest things anyone could ever learn, I highly recommend it, especially for doctors. I think doctors would really benefit by taking a course in clowning because it forces you to let go. It forces you to lose control, which for most practicing physicians is their worst nightmare. But I think we should all face our fears at least once a quarter in our life.
So wait, did you have a fear of clowns?
I didn't have a fear of clowns per se, but I had a very real fear of losing control.
Yeah.
And the only way to be a good clown is by letting go. And I'm so grateful for the time I spent in studying clowning. I actually studied with Philippe Gaulier in France, who is now retired, but he trained a lot of these actors. Like so he was the inspiration for Sacha Cohen Baron's Borat character. He trained a lot of celebrity artists, and spending those weeks with Philippe were some of the most deeply challenging weeks I've ever spent, like studying an art form. But they were also deeply rewarding. And one of the things Philippe told us in class that I'll never forget, he said, it doesn't matter how you're feeling inside. If you're not going on stage and having fun and feeling joy, the audience is going to feel that too. And the whole reason the audience is coming to see you or even the show is because they want to experience joy. And he said, if you cannot experience joy on stage, no matter what kind of character you're playing, whether it's a sad character or a comical character, if you cannot feel joy, then you have no business being on stage. And you need to get off stage until you can figure that out and then come back. Mm. And that really, really shifted my perspective. And I realized, you know what? I need to really figure this out, this joy thing. So I actually quit. I followed his advice. I got off stage. I didn't get back on stage. And I did a lot of deep sort of inner work around like, what is joy? Where does it come from? And why does it matter? And what's interesting is that my practice also transformed as a result, because nobody wants to go to see a physician and they can tell that physician's miserable. You know, it's like you're already miserable. You're the sick one. You're going to get help. And now your doctor's even sicker than you. I mean, there's nothing inspiring about that. And I realized like there is something really important here in finding that inner joy, because it's going to impact everything else you do, whether it's on stage or off stage. And so that was the gift of clowning that I'm taking with me for the rest of my life.
Yeah, it is very relevant in all areas. If you're, whether it's physically being on stage or physically being just anywhere in your life, if you're not finding joy or it's making you completely miserable, you have to get off for a little while.
And, in our culture, there's so much of an acceptance around the hustle, the grind. Like if you're not working super hard, like you're not working. There's sort of this expectation that misery is necessary for success. It's necessary for achievement. In many ways, slowing down, experiencing joy, experiencing satisfaction in sort of the simplicity of things is a sort of revolution. It's a form of resistance. Um, and I love that. Like I'm all about that, you know.
Let me take a step back here for a moment because I want to get into the work that you do as a physician and how that now translates into the work that you do. You mentioned that at that time you were like, well, I'm not happy. There's no joy here. I'm miserable, and I have patients that are coming in, and I need to. You felt almost like a bit of a hypocrite of trying to help people, but you weren't there. So how does that translate now in what you do in your practice and treating
So
patients?
yeah, it's completely transformed the way I practice. Like for example, I made a very conscious decision to walk away from the insurance-based systems. And the reason I realized I needed to do that was because this was a middleman that was literally getting in the way of my relationship with my patients. Um, and frankly, it has no business there. You know, this is literally an industry that is designed to make money, which defeats the entire purpose of the physician patient relationship. And so I made a conscious decision to walk away from that. And what ended up happening is that suddenly I could spend as much time as I wanted with people. I could take my time and I was having more satisfying relationships. And what's not surprising is that the outcomes would be better.
Mhm.
Turns out, if you spend time listening to a person and really getting to know them, you're more likely to help them effectively and maybe prevent them from going to the hospital or needing an unnecessary procedure. And so the quantity of patients that I saw went down because I wasn't doing like 15-minute visits a day the way I used to when I first came out of residency, but the quality went way up and the
Mhm.
satisfaction went way up. And I started getting more hugs in my day-to-day practice. And so I felt more satisfied. I felt like I was doing more meaningful work
Mhm.
than just slogging around. You know, back when I was working like in a small group private practice, seeing patients every 15 minutes, like insurance brace, I cannot forget how after every visit, when I would close the door and walk out of the room, I will never forget that sinking feeling in my chest that I had where this little voice would tell me I could have done more for them,
Mm.
but then I would have to just move on to the next person. And those, you know, you feel it in your body. Like my body remembers that. It's never going to forget that. And I realize not only do I deserve better, but I think human beings deserve better. Our patients deserve better.
And hugs are really good. I love hugs.
I love hugs. And it's like the best medicine. Like it's like cheap. It's like, yeah.
Yeah, nothing better than a good hug. Like don't
Yes.
half-ass the hug with me. Like come
But
in.
I always ask for consent. I remember once I
Yeah.
was in this meeting and I was meeting this person for the first time. This wasn't a patient. This was like for something else. And I had zoomed with this person for a long time. And then so when I finally met him in person, I was like, "Oh my God, it's so nice to meet you. Like, are you okay with hugs? Like, can I hug you?" And I remember he was like, "No, I'm not." And I was like, "Oh, great. Like, I'm so glad. This is why I ask because
Yep,
you never know. You just can't assume." So
it's true.
always consent first, then hugs are great.
Consent and hug. Um,
Yeah.
so you were in a small private practice that you were, again, kind of, for lack of a better term, like churning and burning patients.
Yeah. Yeah.
And now you are in a private practice for yourself.
Yeah, so I went solo. I basically went solo, and I share office space with an acupuncturist.
Mhm.
And I that's very intentional also because I while I have been trained in sort of the allopathic, to use the term, Western model, um over the years I've realized like that's just one way of looking at health, and there's all these other incredibly well thought out systems that exist. Traditional Chinese medicine is just one, to name a few, that have completely different approaches to care. And what I love about sharing office space with a practitioner that has a completely different frame of reference is that I actually think the patient gets the best care because you're now borrowing from all sorts of modalities. So if you have a problem, we're going to tackle it from the east, from the west, from the north, from the south, from, the inner black hole and beyond. I mean, we're going to get it from every single angle.
Mhm.
And so I find it to be really more satisfying, and I also love talking to practitioners who are just looking at problems from a different perspective. Like
Yeah.
I relish that.
I love that. Your holistic approach and looking at the body as a whole, I think is so important. I want to dive a little bit deeper about how you do dive into that with a patient, in creating that mind body connection, and just kind of bringing that whole self into play.
Totally. So, uh, generally, the way I think about it, so first and foremost, I was trained in the allopathic realm, spent many years. So I'm very versed in looking at medical ailments from a very analytical, objective perspective, right? So, like, if someone comes to me with an ailment, for example, let's say they're feeling fatigue, very common complaint, right? The first thing I do is say, okay, are there any reversible nutritional causes of this that could be explaining? And that's where my background really comes in. I'm not only board certified in internal medicine, I'm also board certified by the American Board of Obesity Medicine. And what that is essentially I've done a little bit deeper dive into macronutrient metabolism. So I understand the impact of food on health, but also how nutritional deficiencies can lead to problems as well. So I like to first look at sort of the body from a very objective perspective. Like, are there deficiencies that we're catching in blood work that maybe could be explaining your fatigue, for example? Okay. And then once we rule all that out or troubleshoot that, then I start to look at what is going on psychologically in this person's life. Like, what are the stressors? What was their childhood like? Did they have a lot of childhood traumas? Um, are they going through a major period of transition? And I always make sure and ask, like, are you open to the idea that this could be related to something psychological? I never assume that because you just don't know where people are coming from. And then, sort of, to me, practicing medicine without understanding, does this person have a spiritual part of their life? What is their ancestry? Where do they come from? All of these things play an important role in someone's total health. And so I like to kind of go stepwise, piecemeal, one at a time. And, the result is eventually looking at the person from a very multidimensional perspective and really honoring them, honoring what is present for them and how their belief systems play a role in what's going on.
Interesting. The ancestral component is so fascinating. Could you talk a little bit more about that?
Yeah, definitely. If someone looking at what part of the world a person's ancestors come from can have an impact on, like, if they might be predisposed to a certain set of diseases or not. We know, for example, um like Jewish community. definitely is a community that needs to be screened for certain genetic conditions that we know predominantly affect that community. In my community, the Kashmiri Pandit community, thyroid issues are really common. Why? Because in that part of the world, uh, iodine deficiency is very common, and iodine deficiency can lead to thyroid issues. Um, we know that there are certain parts of the Mediterranean and even Africa, they might be prone to like sickle cell, which is a disease where your blood cells are shaped differently and it can affect your ability to get oxygen. So I think it's always important to look at what part of the world is this person coming from, because there could be something that we might want to play in to. I remember there was a client who had a shared European ancestry, very Nordic, and they were living in more southern part of the United States, and they were experiencing like a lot of profound sweating. And one of the things that I asked was, what part of the world is your ancestry from? And the answer was, oh, way north, like Norway, Sweden. And I was like, what happens to you when you visit those regions? And I remember they basically said that like they feel completely normal when they go to those parts. Like they don't get sweaty at all. They're just like super happy and peaceful. And I was like, okay, that's really interesting. That's like a very interesting data point, because it's like your ancestry comes from those really cold places, so if you're living super south and it's like very hot and humid, like you might not be used to it.
Right. That's really interesting. Um, that also to that point, it's have you ever heard of astrocartography?
No, I haven't. Tell me
So
about this.
so there's this it's a form of basically taking your astrological signs and your chart and that determining where you're supposed to live.
Oh, wow. Have you done this?
I have, yeah, I have.
Oh, and where
I'm
are you
guilty.
supposed to live?
Hawaii, California, yeah, Hawaii and California primarily. I don't know if anywhere in Europe, but my mother's Italian, my dad's German, and there's some Welsh in there. But I'm back in Philly, and the humidity is just killing me. But yeah, yeah.
Well, I think my astrocartography is I'm supposed to live in a Tahitian mansion, and yes, never worry about anything ever again. Like
Nope.
that's my astrocartography.
Yep. That
That's
I
funny.
living on an island with just like no care in the world. Yep.
I love how you're like, oh, my ancestry is like German and European, but I'm supposed to live in Hawaii.
Yeah. Yeah. Like,
That's so
of course,
funny.
I'm like, is this a joke? So I want to talk a little bit. You talk a lot about some of the modalities that people do come, or the conditions that people do come to you about specifically, and PCOS, insulin resistance,
Yeah.
endometriosis, being pre-diabetic.
Yeah.
Some of these things take a while to also get diagnosed, and
Yeah.
women in particular, I feel, have to fight really hard to get. It's like, oh, all of your blood work is coming back okay.
Yeah.
So what if somebody comes to you and is they provide you their medical history, the symptoms that they're diagnosing, that they are experiencing.
Yeah.
You mentioned some of the questions that you ask and how to kind of get in from a holistic perspective. What happens after that?
Yeah, and I think it's really important to name that you really need to listen to your patients. And when I say listen, I'm not just talking about like with your ears. You really have to listen with your whole body.
Mm.
You have to be so present and so attuned that you're really feeling into what they're experiencing. I think that is so critical. Um, After listening to them very carefully and then determining, hey, you might need this workup, like get you to a specialist. And if you don't connect with the specialist, let's get you a second opinion. Let's find the answers until you feel satisfied. And even if that exercise ends up leading to a massive workup where everything comes back normal, there's still value in like, okay, well, at least all of these other serious things aren't the issue.
Mm-hmm.
So there's value in that as well.
Yeah.
I think the way I sort of view every sort of case that I take on is that I am along for this journey. Like I'm committed to figuring this out. And there have been cases that I have had that were challenging where at first blush I didn't know the answer, but I always am committed to figuring it out. So, I have, lost sleep reading up on stuff and then like in the middle of the night been like, "Oh my God, like this is what it is," and then figured it out.
Yeah.
I do that because every patient relationship that I've agreed to take on, I sort of think about like if this was my own family member, what would I be doing? And with my own family, like, yeah, I'd be staying up late figuring out what the heck is going on.
Mm.
It's incredible though, like if you just listen to people deeply, a lot of times you can figure stuff out. The majority of times, people who have gotten the runaround from the medical system, they just haven't gotten the luck to be with providers that really listen for whatever reason. And I believe a lot of providers don't listen because they're burnt out, overworked, seeing 20 patients a day. Their bandwidth is low. One of my mentors, Shola Arewa, author of Opening to Spirit, she talks about how you cannot pour from an empty cup. And it's very common, especially in professions where people are giving, that people feel an obligation to keep giving, even when they have nothing left to give and their cup is empty. But you're really doing people a disservice by pouring from an empty cup. You can be more present, more attuned if you're taking care of yourself.
Dr. Wali, how do you fill your cup? How do you stay grounded? How do you take care of yourself? Because you are giving a lot of yourself to help people.
For me, I think my medicine is nature, specifically sunlight. So one of the things that I really need to do is I wake up very early in the morning, like around when the sun rises. And I go outside and I get that early morning sunlight. That to me is like, I feel like that literally recharges me and gives me life. And it's funny because like in ancient, you go to a yoga class, like wherever in West LA or something, it's like sun salutation is the yoga pose that, is completely westernized. But there really is something about that ancient Kemetic practice of doing a sun salutation. Our biology is tied to this circadian rhythm of sunlight. And so for me, every morning when I go out and I get some sun, and just even allowing it to, enter the vicinity of my vision, it sort of turns me on and recharges me. And then, if let's say I have a long day of calls and I take breaks, I go outside, I walk, being in nature, like leaves and soil, and nature is my recharger, basically. And even if you're like in Manhattan, which is a concrete jungle, like you can still go outside and see the sun. So you are accessible to nature anywhere in the world. So that is truly my medicine. And of course, I as much as I can, I try and do mindfulness practices before I see any patient. I try and do some sort of breathing or grounding just to get present. So I'm really there for them. And then, I try and avoid as much as possible, like eating highly processed foods that I feel really lower my energy. You can sort of really feel the drag come down. So I try as best as possible to eat simply, quite simply.
Yeah. Well, speaking of eating, the part of your practice is you are also an obesity physician.
Mhm.
Um, how how do you approach someone who is like, hey, I've tried every possible way of losing weight. I can't, nothing's working. I've done this, I've done that. What is your approach to treating somebody and treating obesity as a disease?
Yeah, so very similar kind of thought process. Like first, actually, I rarely look at someone's weight. I rarely ever look at like weight BMI. I don't actually really use those numbers, believe it or not. I look at the person in front of me and at, what are they experiencing? And then also if I go straight to objective data like blood work. For example, there are blood levels that you can measure, like insulin is a hormone that your pancreas produces. You can check that in your blood work. It's a relatively inexpensive test. You can basically tell based off of someone's insulin level if their body is in a weight gain or weight loss mode.
Mhm.
And essentially, based off of that level, you can essentially figure out what their diet is doing and how their diet is impacting that. So I like to rely on very objective data. Like for example, if you do a screening for diabetes and someone has prediabetes, that is a much more helpful clue on like what they're eating and how we can put that in remission than how much they weigh.
Mhm.
So I like to use objective lab data to say, like, hey, okay, this is the ailment that you have. Let's reverse this and let's use certain foods to reverse this.
Mhm.
And so I really work with the person where they're at and
Mhm.
also what their cultural background is as well. That plays a huge part in whether or not someone can work it out. Like, prediabetes is a great example. Very Diabetes and prediabetes is so common in my community, in the Indian community, Kashmiri Pandit community. And, one of the easiest things a person can do to reverse prediabetes is carbohydrate reduction.
Mhm.
But telling a Kashmiri person, like, eat less rice, is like blasphemy. You know what I mean? Like the Kashmiri word for dinner is butta, which means rice. The Kashmiri word for rice is butta, which means dinner. So it's like literally you're telling them like don't eat dinner, so it's like you have to work with a person and their culture, right? So it's like, okay, let's figure out a way that we can do this differently. So, we come up with alternatives that like are worthy, culturally worthy. But I really try and individualize it, and I really try and meet the person where they're at, but I always rely on like objective data, and I always make it a relationship that we're in this together. Like
Mhm.
if this for example, meal plan that I suggested is not working for you, like that's fine. We're going to figure out something that does work for you. And the other really important thing is you have to look at what is motivating that behavior.
Yeah.
What's so much of what I've realized and the studies have shown is that childhood trauma can play an impact on the development of eating behaviors later on that can be harmful, right? And so, like, unless you work to heal that trauma, the behaviors won't change, right? And so, that's where the beauty is that trauma can be healed. And so we also work towards those things like, okay, do we need to do a deeper dive into what happened as a child, and that's what's playing a role for today? Maybe it has nothing to do with following a certain diet. Maybe it has everything to do with like going back in time and really addressing like the root pain.
Mhm. Well, it's interesting that you talk about the trauma piece because that is something that you do specialize in as well. It's of ketamine therapy and using psychedelics. Can you talk a little bit more about how you implement that into your treatment plan?
Yeah, absolutely. I mean, I came into the world of psychedelics through my work in obesity medicine,
Mhm.
looking at obesity as a psychosocial response to childhood trauma. And I was trying to see what other options there were out there for patients. And so I came across the data around various psychedelics being helpful for the treatment of PTSD, anxiety, and depression. And as of right now, ketamine assisted psychotherapy, or the use of ketamine to treat treatment resistant depression, is currently FDA approved. There are some other psychedelics that are currently in the FDA pipeline. And just to give some reference, like I was involved in the psychedelic trials at UCSF as a psilocybin facilitator, and I'm also trained as an MDMA assisted therapist for research purposes. So there's a lot coming down the pipeline, but in my practice, it has been meaningful to see how ketamine as an agent can help certain cases of treatment resistant depression. You know, there's so many cases that come to mind. A couple that that I'm just thinking about right now is someone who had really bad depression and obesity and was actually unable to walk because the depression was so severe and the obesity led to significant chronic pain. We obviously did the same approach. We ruled out nutritional deficiencies. We addressed that. We changed the diet. But it was actually the ketamine that really helped precipitate the breakthroughs around their behavior, that eventually the person was able to not only lose the weight, but they were able to eventually walk and their depression went away.
Mhm.
And this was someone who came in, on multiple medications, like had tried basically everything. So the agents like ketamine, what they do is they sort of open a window for the possibility of seeing things from a different perspective. And it doesn't force a person to change, but it gives a person an invitation to say, perhaps if I were to think about things from this perspective, how would my life change? And then the person still has that sort of free volition to make that choice. And sometimes they need time. If they've been living in a certain behavior pattern for decades, asking someone to change overnight, even if they have a powerful ketamine experience, it still might take time to integrate that lesson. And that's why with ketamine assisted psychotherapy, there's such an emphasis on integration because you experience these big insights with ketamine and you still need to integrate the lessons.
Mhm.
Um, I can speak sort of with my own experience. I have tried ketamine assisted psychotherapy for my own healing journey, and the issue that I went to go see the therapist for was around my relationship with my father, which has historically been very tumultuous. If I say right, he says left, kind of thing, and that affected me for a very long time. And so I finally brought it into the ketamine session, and thanks to the ketamine and the therapy, I was actually able to see my energy and my father's energy from a very different perspective. Like I suddenly saw us as two very big energies that, of course, when they would get close together, there would be a clash. But it wasn't personal. It was just what naturally happens with big energies coming together.
Mhm.
And the amount of peace that I experienced after seeing my relationship with my father from a much bigger energetic perspective, which was really sort of a much more loving perspective and less judgmental, it gave me a lot of relief and peace around the situation. And now, and don't get me wrong, it's not like I don't have disagreements with my father. He still irritates the heck out of me with some of the things he says, but I love the guy, right? And now when I interact with him, there's a sense of almost like looking at it when we get into these little frictions, I suddenly can separate myself and be like, oh, of course, this is what happens because I'm like this and he's like this. And I almost kind of smile now and laugh it off. Like it doesn't affect me so deeply now. I'm just like, oh, yeah, this is just like the way things are and it's okay. So that was like a huge breakthrough for me because I was really suffering from it for a while.
Mm. How had you been navigating that in prior to the ketamine assisted therapy, or not, maybe not navigating it at all?
I mean, I think navigation is like, I think there was just, I was, let's just say so much money spent in talk therapy like that like just like session after session of just crying and frustration and that all dissolved and it just it really the ketamine, I credit the ketamine to really giving me that peace.
Yeah. Did you have, when you had kind of that aha moment, did you share that with your dad?
You know, um, that's a good question. I don't think I think if he listens to this podcast now, he'll be like, "Oh, okay." I don't think I outright shared it with him. It's it was a quieter realization. I mean, it happened, I share it obviously with my therapist and now with the rest of the world in this podcast. But no, there wasn't like a big breakthrough moment or like a watershed moment with my dad. But I can tell you, like, there was more peace. And maybe that peace he picked up on.
Mhm.
Um, and it suddenly turned from like a very tense relationship to a more friendly, lighter, and certainly more loving.
Yeah. If somebody's resistant to trying ketamine assisted therapy, and you've, with your personal story and how it's helped you, and knowing kind of that the trauma side that somebody might be experiencing, how do you walk them through that?
My approach is very non pushy, I guess. Like if
Mhm.
someone is resistant, I don't push it. I can say like this is an option, but if someone has resistance, you got to honor that. You got to
Mhm.
honor why they feel the resistance. Like resistance is a defense mechanism and they're defending something. And um it's not my place to push that kind of agenda.
Yeah.
It's about meeting people where they're at. If there's resistance, we have to be with that resistance and honor that, and we cannot push that. A majority of the patients that I dose, they come to me. Maybe they've read about it, they've, watched something, a program, they're curious, and then I will meet them there.
Mhm.
But I wouldn't I'm not in the business of trying to convince someone because the work isn't easy. It's not all, unicorns and rainbows and love and light. I mean, it's
Yeah.
you're going to parts of your psyche that you've probably left alone for whatever reason, right? And that can be difficult. There are some heavier things to deal with. And a person um shouldn't go there unless they're ready.
Yeah.
Of course, it's totally normal and natural to experience fear. I mean, the night before I was telling myself that, the morning of, I was like, I can't do this. Like, this is a terrible idea. So you feel fear. In fact, if you're not experiencing the fear, it's like fear is generally a sign that you're on the edge of something really new.
Mhm.
And it takes a lot of courage to push through that, right? So fear is really normal and expected, and it's welcome as well. Um, but there's a fine line between being open and fearful versus being resistant and sort of coerced into doing something. And I definitely don't ascribe to coercion.
Yeah.
And I also just want to make a plug that, when it comes to healing trauma, there are also many, many modalities that exist out there that do not use any sort of substances
Mhm.
like ketamine or the likes thereof. EMDR therapy is a very, very effective tool for treating trauma and PTSD. Breath work can also be holotropic breath work can also be extremely helpful for people. Sometimes doing a Vipassana meditation retreat, going away in silence for 10 days can lead to immense breakthroughs. I mean, these are all processes without pharmacology
Mhm.
and very, very profound and effective. Um, so yeah, I just want to name that you don't have to use these substances to heal from trauma, but they can certainly be helpful if done in the right set and setting.
Sure. It's interesting that you brought up breath work. I tried breath work in, my gosh, it was probably 2013. Um,
Uh-huh.
there was a little studio in Venice on, I believe it was on Venice Boulevard.
Okay.
And this breathwork coach, it was a group breathwork class, and I remember going with a friend, and she's like, I think you need to come to this class with me. And I remember walking in, and there's mats all around, and there's blankets, and there's boxes of tissues everywhere. And I
Yeah.
was I was a little cynical. I'm not gonna lie about that. And I was like, why do we need blankets and tissues? And you are doing that very specific breathing pattern for 20 minutes, and then
Yeah.
the breathing pattern switches, and all of a sudden my fingers were like claws.
Right.
And I remember I just started uncontrollably sobbing, and it
Hmm.
was just waterworks, and the floodgates opened. And I just remember laying there at the end of the class, and then all of a sudden there was this overwhelming amount of peace. And
Hmm.
then I remember leaving, and I was like on an adrenaline rush. I was
Right.
like, that was incredible. It was, it does require, it's a practice. It isn't easy to do, and to ground yourself into that spot for almost an hour, but it's
Oh
so worth it.
no. Yeah,
Yeah.
it's holotropic breath work is incredibly powerful.
I didn't want this to be a focal point of our conversation, kind of why I'm saving it towards the end. But how are you seeing, or how have the presence of GLP-1s impacted? Is that how? What are your feelings towards them?
My view on GLPs is you have to look at the individual person. I've had cases where GLPs have really made a difference in a person's life. And you just have to meet someone where they're at. The data really shows that they can be helpful for weight loss. Once the GLPs are stopped, it does lead to weight gain about a month after stopping them because it takes the medicine about a month to wash out of your system. But what they do see is that those who do gain the weight back, they never really return to the weight that they started at when they first took the medicine. Um, I think the same sort of principles apply where you have to figure out your eating habits and your behaviors and your lifestyle. I don't think the GLP excuses you from that, especially if at some point you want to get off of it. But I can say that, yeah, there have been some incredibly helpful cases where I've used it. I have a couple of cases of people specifically with Hashimoto's thyroid issues. And part of the challenge of treating Hashimoto's is it's an autoimmune disease. So there's antibodies that are created in the thyroid, and bringing those antibody levels down can be very challenging. Ironically, I've seen cases where the person was started on a GLP for whatever reason, and they finally, after years of struggling with Hashimoto's, their antibodies are now down.
Wow.
So, we do know that these GLPs are working with bringing down inflammation across the board by impacting your hormones. I am neither sort of like for nor against them. I sort of just look at the person.
Yeah.
And the types of people that come to me, some of them are like, no, I don't want to do that. I want to do this the old school way and figure it out. And then there are people that are like, look, I've tried everything. Like, can we try this? And I meet people where they're at.
Yeah.
I do think a lot of people are on it these days. And I think it's really important, um, to make sure that if you are on it, you're not experiencing terrible side effects or some of the riskier complications of it. But I do think it has helped a lot of people.
Yeah.
So I think it just depends on the person.
Yeah. Well, I appreciate you sharing your thoughts on that. I guess as we're getting close to time here, I want to pivot back to your stand-up comedian career. Are you doing anything? Do you have shows lined up? Are you performing anywhere right now?
So I would say, as far as stand up is concerned, I think I've close to officially retired from old school stand up. And I'm actually like thrilled to say that because I felt like I had reached this point in my stand up career, and this is before I started studying clowning, where I was sort of just going through the motions and performing, and of course like making people laugh, but I had perfected the art of doing an act without being 100% present. And I think I was also using stand up to hide from other emotions. I was falling behind humor to instead of facing some other more heavier emotions that are harder to bring out on stage. Now I do acting, so I love acting, and I'm still a performing artist. In fact, in a couple of days, I'm heading to West Hollywood for the Holly Shorts Film Festival. One of the short films that I was in is going to be showing. So I'm still very involved in sort of the performing arts community, but as far as old school stand up that I used to do, I think I'm taking a very extended break, possibly early retirement, because I've just found other modalities of performing arts that I just find to be so much more joyful.
Yeah.
And so I'm just really excited to keep delving into that.
Yeah. Okay. Well, I'm
Yeah.
excited for you and excited for that film fest that you're going to be attending.
Yeah, it's gonna be a blast. It's at the Man Theater where the Walk of Fame is, or
Yeah.
the Star Walk stuff. So it's gonna be fun.
I really appreciate you joining me and talking about everything that we've discussed. I think the work that you continue to do and coming and meeting people where they at, it's so important. And as a woman who I feel like also has had to advocate for various things for my health, I think that it's just so important for somebody that has taken the time to sit back and say, I am here to listen, and I'm listening with my whole body and understanding your whole body. So thank you.
Oh, well, thank you so much for having me. I had a blast. This was a lot of fun, and I felt like I was just sitting right there on that green sofa right next to you. So thank you so much for the opportunity.
Yeah, absolutely. Well, thank you. That was Dr. Priyanka Wali. I am so excited for this conversation and for all of you to hear it. Thank you for tuning in to Morning Waltz podcast. Until next time, thank you.